So the implant procedure that I do is, first of all, we always take the actual CT. So the individual comes in, we take the x-ray. CT is just an x-ray, it's a very specific one. I will consult with a few other people typically to find out kind of what would be the best implant to actually place there. Once we do that, we have a chat. And what I'd like to do is have a stent made. And what's a stent? A stent is just something that's going to fit over the area in which we're going to place the implant. It has a little hole in it, very small hole, which we use this little instrument that fits into it that allows our pilot drill, which I've talked about earlier, to just go through that and actually go exactly where it is supposed to go. So the process then is very simple. You come in, I put the stent in, we make a mark, we get you numb, we put it back in there, we basically place the implant. That's a 5-minute process. Not that that's the most important thing. The most important thing is getting it right, so we will take the time to get it right. It's not a speed test. We will verify it on the actual CT, and you will go home a very happy patient.